Hey everyone, welcome back to Health Insurance Tips. This video I'm going to cover and briefly explain premiums, deductibles, copays, coinsurances, and out-of-pockets, what they are and how they apply. So first, premiums. Everyone should know by now what a premium is, and that is that specified amount that we pay to the insurance company on a monthly basis just to have insurance. Second, we have deductibles. A deductible is also something that the patient will pay out of their own money prior to the insurance company paying for any health or medical services. So every time that you make a visit, you will pay a portion until that deductible is met. Once that deductible is met, then your insurance company will begin paying a percentage of covered medical services, which brings us to copays. Copay is a fixed amount that the patient is going to pay the provider for a service before receiving that service. And that is usually in the insurance policy. You're going to see that specified copayment amount on your card, mainly your primary care, your specialist, your emergency room, and your urgent care. You will also see prescription, generic and brand on your insurance card as well. Coinsurances is slightly different because a coinsurance is where the insurance company is going to pay a certain percentage and then the patient is going to pay a certain percentages of whatever services were rendered. So usually you're going to see like an 80-20, sometimes a 60-40, or even a 70-30. The majority of the time people will have an 80-20 because they want the insurance to pay the highest percentage amount, which applies to the out-of-pocket costs. So you're going to have an individual and you're going to have a family out-of-pocket. So if each individual and family, for example, have a $5,000 out-of-pocket cost, those co-payments and those co-insurances that the patient is paying out of their goes towards that out-of-pocket cost. Usually, most people will meet their out-of-pocket cost between mid towards the end of the year, which is when re-enrollment kind of comes around. That's when the insurance company will start paying at 100% of all covered health and medical services. So that's just a brief description of premiums, deductibles, co-payments, coinsurances, and out-of-pockets. Hopefully it was something just simple and easy that you guys were able to kind of grasp and understand what each of these are and how they apply. So thanks so much for joining me again. See you next time.